Substance use and addiction are complex and multifaceted issues that affect individuals, families, and communities. Addiction is a chronic, often relapsing condition characterized by compulsive substance use despite harmful consequences. It is not merely about physical dependence on a substance, but also involves a psychological compulsion to use it. Many factors contribute to the development of addiction, including genetic predisposition, environmental influences, mental health disorders, and life experiences. Understanding the underlying causes and effects of substance use is essential for developing effective treatment strategies. Addiction is a disease of the brain that impacts how an individual thinks, behaves, and responds to situations. This disease can change the way people view the world and interact with others, making it particularly challenging to break free from its grip. The first step in treating addiction is understanding that it is not simply a moral failing or a lack of willpower. Addiction is often driven by a combination of biological, psychological, and social factors. Brain chemistry plays a significant role in addiction, as the repeated use of substances can alter the way the brain functions, affecting areas responsible for judgment, decision-making, and reward processing. This alteration can make it difficult for an individual to stop using the substance even when they are aware of the negative consequences. For example, substances like alcohol, opioids, and stimulants can trigger the release of dopamine, a neurotransmitter that plays a crucial role in the brain's reward system. Over time, the brain becomes reliant on the substance to feel pleasure, and the individual develops a tolerance requiring more of the substance to achieve the same effect. Substance use disorders can have a profound impact on physical health. Chronic use of drugs and alcohol can lead to a wide range of medical conditions, including liver damage, heart disease, respiratory problems, and neurological impairments. It also increases the risk of overdose, which can be fatal. Additionally, substance use often disrupts sleep patterns, compromises the immune system, and impairs cognitive functions, making it difficult for individuals to carry out daily activities or perform tasks at work or school. The physical toll of addiction is one of the many reasons why treatment is necessary for long-term recovery. The process of recovery is not only about stopping substance use, but also about healing the body and mind from the damage caused by prolonged use. Psychological factors also play a significant role in substance use and addiction. Many individuals who struggle with addiction also face mental health challenges such as depression, anxiety, trauma, or post-traumatic stress disorder. These conditions often coexist with substance use, creating a vicious cycle where the individual turns to substances as a form of self-medication to cope with emotional pain or distress. However, substances provide only temporary relief, and in the long run, they can exacerbate mental health symptoms. Treatment for substance use disorders must address both the addiction and any co-occurring mental health conditions. Integrated treatment approaches that focus on both mental health and addiction are crucial for improving outcomes and preventing relapse. Therapy plays a central role in the treatment of substance use and addiction. One of the most widely used and evidence-based forms of therapy for addiction is cognitive behavioral therapy. This type of therapy focuses on helping individuals identify and change unhealthy thought patterns and behaviors related to their substance use. It also teaches coping skills to manage triggers and cravings, allowing individuals to make healthier choices and avoid relapse. Cognitive behavioral therapy is particularly effective because it empowers individuals to take responsibility for their behavior and learn how to control their responses to situations that may lead to substance use. In addition to cognitive behavioral therapy, motivational interviewing is another therapeutic approach used in addiction treatment. Motivational interviewing is a client-centered, directive method of counseling that aims to enhance an individual's motivation to change. It is particularly useful for individuals who may be ambivalent or resistant to treatment. Motivational interviewing helps individuals explore and resolve any mixed feelings they may have about quitting their substance use while also strengthening their commitment to change. The therapist uses open-ended questions, affirmations, and reflective listening to guide the individual toward their own solutions and goals, rather than imposing external solutions. Group therapy is also an essential component of addiction treatment. It provides individuals with a sense of community and support, which can be crucial for recovery. In group therapy, individuals with similar experiences can share their struggles and successes, offer support, and hold each other accountable. Group therapy helps individuals develop social skills and learn how to interact with others in a healthy way. It also reduces feelings of isolation, which can be common among individuals with addiction. Support groups such as 12-step programs or other peer-led groups also provide ongoing support after formal treatment has ended, helping individuals maintain their sobriety and continue their recovery journey. Family therapy is another critical component in the treatment of substance use and addiction. Addiction affects not only the individual but also their loved ones. Family therapy helps address the dynamics within the family that may contribute to or be affected by the addiction. It also provides family members with the tools they need to support their loved one's recovery. Family therapy can improve communication, reduce conflict, and foster understanding between family members. It also helps individuals and their families develop healthy coping strategies and set appropriate boundaries to avoid enabling behaviors that can perpetuate the addiction. Pharmacotherapy or medication-assisted treatment is sometimes used in combination with therapy to support individuals in their recovery. Medications can help reduce cravings, manage withdrawal symptoms, and promote long-term recovery. For example, opioid use disorder can be treated with medications such as methadone or buprenorphine, which help alleviate withdrawal symptoms and cravings without producing the same euphoric effects as the opioid being abused. Other medications such as disulfiram are used to deter alcohol consumption by causing unpleasant reactions when alcohol is consumed. While medications can be helpful, they are most effective when combined with therapy and support, as they do not address the underlying psychological and behavioral factors contributing to the addiction. Relapse prevention is an essential focus in the treatment of substance use and addiction. Recovery is often a long-term process, and individuals are at risk of relapse even after achieving sobriety. Relapse prevention strategies help individuals identify potential triggers, develop coping skills, and create action plans to manage high-risk situations. These strategies teach individuals how to cope with stress, emotional distress, and social pressures without turning to substances. Learning how to navigate life's challenges without using substances is a vital part of the recovery process and helps individuals build resilience and confidence in their ability to stay sober. Finally, aftercare and ongoing support are crucial for maintaining sobriety and achieving long-term recovery. Addiction is a chronic condition, and individuals in recovery need continued care and support to help them navigate the challenges of life without substances. Aftercare may include continued therapy, participation in support groups, or involvement in sober living communities. These resources help individuals stay connected to others in recovery, build a strong support network, and stay focused on their goals. It is essential for individuals in recovery to continue working on their mental and emotional health, as relapse can occur when individuals feel disconnected, overwhelmed, or unsupported. With the right resources and a commitment to recovery, individuals with substance use and addiction can lead fulfilling, sober lives.